Now, if you're a woman and you're having some vaginal symptoms, you want to know, how do I know that this is not a sexually transmitted infection? Also known as an STI. Now, a sexually transmitted infection is something that you can only get if you're obviously having unprotected sexual intercourse with a partner who might have been with other partners either recently or previously, usually within the last 6 months. Now, symptoms of a sexually transmitted infection can include lower abdominal pain or pelvic pain, which can be constant or comes and goes. You might also experience bleeding in between your periods. So if you've got regular periods, let's say your period is on the 28th of January, your next period might not be until the 28th of February, but you might notice that you've got 2 or 3 episodes where you have spotting or bleeding or pink discharge in between periods. You might also notice that your periods were previously regular, but now they've become more irregular. You might also have what we call prolonged bleeding or prolonged periods, where basically your periods would usually last for a week, but now they're lasting 2 to 3 weeks. Some women might also notice they have pain during intercourse, which they might describe as a sharp pain, which can happen either on superficial or deep penetration. You might also have bleeding after intercourse. Might not be after every session, but you might notice spotting or bleeding after intercourse. You might also notice an abnormal vaginal discharge, which might be creamy, or it might be yellow or green, and in some cases you might have an unusual odor to the discharge. Or you might also notice an unusual smell coming from the vagina. You might see some sores or rashes around the vagina. You might have what we call genital lesions, where you might see warts or ulcers, which look like herpes. And in most cases, you might feel generally unwell. You might have fever symptoms, you might feel bloated, and you might notice the presence of lymph nodes around the groin area or around the neck. So these are all signs and symptoms that you might have a sexually transmitted infection, which is usually an indication that you need to go to the sexual health clinic to get yourself checked, where you might have various tests such as what we call an STI screen. So if you have any of these symptoms, get yourself checked out.